Okay, so let's look at this client medical history form. So the other, before we do this, the other thing about hygiene that I wanted to mention, so clean hands before massage, clean your hands after. If you want to, after the feet, if you've got access, that's fine too. The other thing about hygiene is things like not breathing on people. Okay, so especially when you're massaging the face, it's very easy to sit there and go, oh, what am I doing? And you breathe all over the person. The person will definitely notice it. It's not a very pleasant thing to have. You might not notice it. Be aware. So when you're massaging near the person's face, when you breathe out, turn to the side. Okay, very important. The other thing is for people that smoke, they have to really clean their hands because a lot of the time they'll massage people and the person will pick up the smell of the cigarettes on their fingers, which isn't very nice. We had complaints about that in our class before. Okay, from one student complaining about another student, their fingers stunk of cigarette smoke. Okay, so be aware of that. And don't sweat on people. That in my advanced course, I had this guy working on me, a fantastic massage. He was sweating, he was just sweating all over. I'm like, Ashley, you've got to stop sweating on me. You know, put a towel down or something. You know, it's like you're doing such a great job, but all the sweat dripping all over me is not adding to the experience whatsoever. You know? Okay, so be aware of that. Okay, so let's just look at this client medical history form. So first here we've got all their contact details, which is always good. Where did you hear about us? That's good for your marketing. If you wanted to know if somebody's referring people or whatever form of marketing you've got, is it working or not? You know, you can always, like, a lot of people come for one massage and then they loved it, but they forget about it. If you have them on an email marketing list, you could always email them, annoy them with their spam filters a little bit more.
If you don't come back, you'll die.
Yeah. Some people will send people out like a free massage or half-price massage for their birthday and different things as well. All sorts of little things. So. Okay, the rest of it's like our case history. Do you have any injuries or complaints at presence? Okay, so yes, you know, indicate what they are. Have you had any operations or dental work? Why we say dental work is a lot of tension in the jaw can come from dental work as well. Okay, so it's nice to know if they've had some dental work, can affect a whole lot of their tension in their jaw. Do you or have you ever suffered from any of the following conditions? Please circle. Asthma, epilepsy, stroke. Okay, so asthma usually, it's good for the person to have their Ventolin near if they have asthma. Sometimes I've seen people have mini kind of asthma attacks during a massage. But also it'll show us that they have a lot of chest tension, and with chest tension comes belly tension with asthma. Okay, so we talked about epilepsy, a stroke or heart attack. Basically what we have to be careful of with strokes and heart attacks is that we don't get so much blood flow moving that it's going to put pressure on the heart. So we're going to keep the pace of our massage quite slow, not too fast. Osteoporosis, we already mentioned. Varicose veins, we mentioned cancer, we talked about migraine. Migraine, we're just going to be aware that their tension's probably coming down the muscle beside the spine, or it's coming from here causing migraine, so we're going to have some idea where to look. And we're going to be careful not to overstimulate the back of the neck, which can bring on a migraine. High or low blood pressure. High blood pressure is similar. Again, we don't want to the stroke and heart attack. We don't want to increase the flow too quick because it's going to put pressure. You're going to increase blood pressure. Whereas with low blood pressure, we have to be more aware that they could feel faint when after the massage. Getting up, they can feel quite dizzy and disoriented. Okay, so you let them rest for a while until they don't feel that. Do you take any natural, recreational, or pharmaceutical medication? Okay, if the person's got a long list of different pharmaceutical medications or any medication you're not sure of, or you've asked them about it, there could be some side effects, I would get the doctor's permission to say that medication is safe to get a massage with. Some medication can affect massage, some medication makes people bruise really easily. It could have different effects upon the body, all right? So if you're not sure of anything, to be safe, you can get the doctor's permission. The thing is, if somebody's going to work with both orthodox medicine and natural medicine, then there needs to be communication between the two practitioners as to what each one is doing to that person, in my opinion. Okay. Are your bowel movements regular, yes or no? Okay, that'll tell you whether they've got a lot of large intestinal tension, or it's not just tension, it's just blocked fecal matter, which tension can actually cause too. Do you bruise easily? If somebody bruises easily, we have to be more careful. We have to let them know that with our form of massage, it's quite deep. Somebody that bruises easily can get bruised. There's what we call good or bad bruising. In a lot of Southeast Asian countries, they have what they call cupping. Has anybody ever had cupping done?
Yes.
Okay, so cupping is where they put the cups on your back. A lot of people come up with what looks like a bruise. So it's considered bringing the toxic blood to the surface. In some countries, they'll put a leech in the cup, and the leech will drain out the toxic blood. So with that kind of thing, the bruising is toxicity coming to the surface. And that can occur with massage as well. But some people won't be comfortable with that. And so you have to warn them that may occur. People that bruise easily are usually people with pale skin. Pale skin usually shows a weakness in the blood. Bruising is directly related to the condition of the blood. So pale skin, overweight people bruise a little bit easier, and women bruise easier than men. Okay, so if you have a pale skinned, overweight woman, then highly likely that she'll bruise. Okay. Now, sometimes there's also what we call bad bruising. And bad bruising to me is where you've overworked a spot. Like say, for example, like I was saying about the calf muscle is a common one, or you've overworked the inner leg, which is an area that bruises easily. Areas that bruise easily tend to be the inner leg and the inner arm. Okay, and often what happens is where somebody's working the hell out of an area, but they haven't got the roots of the tension out. And that's what I call bad bruising. So they haven't done the work because it's actually, and this is a common thing that people do, they don't do enough work on the hands and the feet. And then they work into the legs or into the arms, and the roots of the tension aren't out, and then they do what they cause bad pain and they cause bad bruising. Okay, so be aware of that. Be careful on the inner leg and the inner arm, and also on the outer.
Can I just ask?
Red meat doesn't necessarily make it so that you bruise. You know, I'm strict vegetarian myself, and I don't bruise easily. You know. It just depends on the person. Usually depends on how much they're absorbing, so how much belly tension they have, and things like that. You know? So there's different things why people bruise. There's a cream that sometimes we give to people called arnica. You can take it homeopathically or put it on.
I did internal and external.
Yeah, so we often keep that in our clinic somewhere for people, you know. But when we ask that, do you bruise easily, then you can talk to the person. If they say yes, then you want that permission to work on them and go, well, this may bruise, you know, are you all right with that, you know? So if they say, oh no, well then you gotta go a lot lighter and maybe not so effective. But it's their, they should have that call, you know?
Yeah.
Because like you say, it's not just you that gets affected. Oh my God, what happened to you? People around. You know, it's one of the biggest problems or one of the biggest complaints that we, in generally in the massage industry, is excessive bruising that people have. And sometimes it's like they freak out, but actually it's not that bad for them, but it just looks bad or they freak out. So knowing about bruising in advance is important.
Yeah.